Hi guys. So today I just wanted to do a quick overview about high blood pressure, hypertension, as it's more commonly referred to. So this is something that's super common. Nearly 30% of Americans are affected by this, and it might be even higher based on the numbers we don't know. And generally, even though we've gotten better about treating it over time, we're still pretty bad at treating it. Maybe only about 50% of people that we treat meet their goal of having a blood pressure less than 140/90. So let's just go over a little bit of things really quick about high blood pressure, hypertension. So normal blood pressure is generally less than 120/80. If somebody has a blood pressure above 120 but less than 140, or a diastolic, which is a lower number between 80 and 90, we could call that pre-hypertension. And stage 1 hypertension is blood pressure above 180/90. And there are different definitions for different populations, such as like diabetics and stuff like that. Stage 2 hypertension would be any blood pressure above 160/100. And it's just one or the other. You don't need both numbers to meet the definitions. So why is blood pressure important? Why is hypertension important to know about? It can cause significant end organ damage. You know, nearly so. For example, let's talk about stroke. Elevated blood pressure can lead to cerebral aneurysms, and those can rupture, and that's what's known as a subarachnoid hemorrhage. It can cause retinal hemorrhages. Long-standing hypertension can lead to arteriolosclerosis, which results in your arteriolar narrowing and distal ischemia, and so then you get these quote unquote small strokes like lacunar infarcts and dementia. In the heart, high blood pressure can lead to compensating myocardial hypertrophy, which will result in impaired relaxation. That's known as diastolic heart failure, which can ultimately lead to heart failure in general. Let's see. In large blood vessels, high blood pressure can lead to pressure-related injury. So you get like aortic aneurysms, you get aortic dissections, and you can also have development of atherosclerosis through disruption of the vascular endothelium. And it can help lead to vascular plaque formation, and this is how you get thrombotic or embolic complications such as heart attacks, for example, and peripheral artery disease. Obviously, kidneys, uncontrolled blood pressure can affect the kidneys as well and lead to chronic kidney failure. It's debatable whether or not you can end up on dialysis and stage renal disease exclusively from hypertension, uncontrolled hypertension, though that is a thought. And so it's thought that 50% of stroke events are secondary to high blood pressure, uncontrolled hypertension worldwide, and 47% of ischemic heart attacks, ischemic heart disease is secondary to that. So that's just a quick review on high blood pressure. There are agents that can increase your high blood pressure. You can even over-the-counter things like NSAIDs can lead to high blood pressure. There's also alcohol is known to do it. Recreational drugs such as cocaine, ecstasy, even some amphetamines can cause your blood pressure to increase. And then there are even some drugs commonly taken, such as some antiretroviral HIV drugs that can cause it. Steroids, definitely. EPO agents, and then even common like psychiatric drugs like SSRIs or SNRIs can cause high blood pressure secondary to adrenergic stimulation. Caffeine is another thing that causes adrenergic stimulation. So that's just a quick review of high blood pressure and hypertension. What I'll plan to do is in the next video maybe talk about some of the treatments, and then also do another video hopefully about causes of hypertension, such as primary, which is essential hypertension, and secondary, where we have identifiable causes of high blood pressure. That's it. All right. Thank you for watching. Thanks. Bye.